The carotid triangle is a subdivision of the anterior triangle of the neck, and it gets its name due to its close association with the common carotid artery, which bifurcates within it. If you've not already watched my video giving an overview of the anterior triangle of the neck, I'd go take a look now. It's only 5 minutes long. The carotid triangle is an area towards the superior part of the anterior triangle of the neck, and it's bounded by 3 muscles. Superiorly, it's bounded by the posterior belly of the digastric muscle. Inferiorly, it's bounded by the superior belly of the omohyoid muscle. And laterally, it's bounded by the anterior part of the sternocleidomastoid muscle. The floor of the carotid triangle is formed by the hyoglossus and thyrohyoid muscles, as well as the middle and inferior pharyngeal constrictors. Of all of the subdivisions of the anterior triangle, the carotid triangle is the most anatomically complex and contains the most individual structures. The most obvious of these is the large common carotid artery, which enters at its inferior part and bifurcates into the internal and external carotid arteries. The internal carotid artery continues up into the neurocranium and gives no branches in the carotid triangle. At the base of the internal carotid artery, where it arises from the common carotid, is the carotid sinus. This is one of the 2 areas where baroreceptors lie, which are the structures that detect blood pressure. From the external carotid artery arise the superior thyroid, ascending pharyngeal, lingual, facial, and occipital arteries, all within the carotid triangle. The other large structure within the carotid triangle is the internal jugular vein. This runs up the neck lateral to the common carotid artery and receives tributaries from veins similar to the aforementioned arteries, these being the superior thyroid, lingual, and facial veins. Most textbooks don't consider there to be an ascending pharyngeal vein, and the occipital vein drains into the internal jugular a lot higher up. There are a number of important nerves in the carotid triangle, namely the cranial nerves. In particular, we have the glossopharyngeal nerve, which runs along the internal carotid artery to supply the carotid sinus, and the vagus nerve, which runs in the carotid sheath between the common carotid artery and internal jugular vein. There are also some large branches of the vagus nerve which we won't cover in detail here. The other important cranial nerve within the carotid triangle is the hypoglossal nerve, which passes through the triangle to supply the tongue. Lastly, the spinal accessory nerve and the sympathetic trunk pass deeply within the triangle, and the ansa cervicalis passes superficially. There aren't really any significant collections of lymph nodes within the carotid triangle. And there we go. That's the detailed anatomy of the carotid triangle of the neck. This is a really important area to be familiar with, as it's referenced all the time in clinical practice. I'll be releasing videos covering the rest of the anterior and posterior triangles of the neck, so make sure to subscribe to the channel so you don't miss out. In the meantime, I hope you learned something and have a great day.